The idea behind the freeze-thaw-freeze approach is that both components, the freeze component and the thaw component, induces an injury, a mechanical injury to the cells. And so it's crucial to exploit the ability of both of them to induce a cryogenic injury. Freezing causes icicle formation within cells, which causes injury to the cytoskeleton and also damages the cell wall. Freezing also causes icicles to form between cells in the extracellular space, which dehydrates the extracellular space. That causes fluid within the cell to flow from within the cell to the extracellular space to balance the osmotic gradient. In the process of freezing, that's what you're trying to do. And then in the thaw phase, once the extracellular cell space starts to thaw, the fluid flows back into the cells. That causes the cells, which shrunk because they were dehydrated, to begin to expand again because they're being rehydrated. But they're damaged cells that are rehydrated, and damaged cells that can't maintain the cytoskeleton rupture. So the idea behind the freezing and thawing is to injure the cells osmotically, injure the cells mechanically by ice crystal formation. And of course, there are other changes that happen as well: vascular injury, immunogenic injury, and other apoptotic injury, other things that induce the effect that leads to cellular damage, cellular disruption, and cellular necrosis. Patient aftercare is the easiest part of all. We apply a steroid strip to the wound. I apply antibiotic ointment to the place where I've injected saline multiple times, if it's a case that requires multiple saline injections. And then I ask the patient to wear gauze on the wound, which is held in place by a bra. Typically, I advise patients to wear a sports bra because there will be some swelling from the saline injection, swelling from the injury from cryoablation, and the sports bra will help to reduce the swelling. I tell them to expect bruising. It's often quite dramatic. It tends to peak about the 3rd to 5th day, but it should be gone by the 10th day. And as long as they anticipate that, they're fine. I usually show them a picture after they undergo cryoablation so that they know what to expect. And for many people, they say, "I'm so glad you showed me that because I would have reacted to that and might have been alarmed." But knowing that bruising is normal after this, as it is for many percutaneous procedures, they're relieved that that's the normal course. In addition, there's no significant activity restrictions. I tell them that they can go back to their normal activities, normal non-strenuous, non-forceful sports-like activities. So self-care, wound care, they drive themselves in, they drive themselves home. They can maintain normal non-strenuous activities and resume them the very next day.